and do the assessments that we did earlier one more time. Bless you. After I've assessed and confirmed the segments that need to be addressed, I'm going to be performing a technique to mobilize these segments that need to be moved. Now, to perform these techniques, I do need to place my hands around your low back area, as well as there will be a point in time when I'll get you to place your arms across your chest, and I'm going to place my arm across your arms for the purpose of guiding you through some motions and some resistance. Purpose of this is to hopefully mobilize some segments that need to be mobilized in your back, but there is a chance we might possibly go ahead and create some discomfort during this. If so, please let me know and we will modify as necessary. Hopefully we will be able to get you some more mobility in your low back. Do you have any questions about what we're doing today? Do I have your permission to continue? Wonderful. All right, so first and foremost, I'm just gonna go and assess. We will find a flexion dysfunction first, and then we will find an extension dysfunction that we're gonna target after. All right, so to assess for a flexion dysfunction, what position are we gonna have Anjali in? Extension. So first and foremost, I'm gonna landmark. Okay, Anjali, I'll get you to go ahead and curl back into extension for me, please. Good. And I'll get you to nice and gently curl forward for us, please. Good, let your hips drop as they go. Good, and back up. And then I'll get you to come back down again, and to go down. And back up. Yeah, it's this right one. Okay, so this right one is not wanting to move. That's what we found last time, which is great. So what we would like to do is we would like to open this facet. So the directions we are going to bring her into to open her right facet is away, away, away. Correct. So what are the three directions that are away, away, away? First direction? Flexion. Flexion forward. So Anjali, I'll get you to curl forward for us, please. Right there, stop. Can you back off for me? Go back to neutral. I'm gonna get you to do that slower for me, please. Go ahead and curl downwards. Good, keep going, keep going, keep going, keep going. Right there, you can hold right there. Next direction.
Lateral flexion.
Lateral flexion. How far do I go?
Until
I feel the segment move. Okay, nice and slowly, Anjali. Go ahead, laterally flex. Keep going, keep going, keep going. Right there. Good. And then last direction.
Rotation.
Rotation which way?
To the left.
Towards the left. You got it. Nice and slowly rotate, 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 rotate. A little bit more right there. Hold right there. Okay, I'll get you to put your arms across your chest for me, please, Anjali. All right, so the position that she's in is away, 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 and I'm going to try and help encouraging opening this facet. So to perform the MET, don't lose your landmark. So patient is facing one way, you are literally facing the opposite way. The side you are on is the direction your patient is leaning towards. So in this case, I am holding her in this position. Okay, Anjali, from here, I'm gonna hold you in this position. I'm gonna get you to, in three directions, the opposite away, towards, back to neutral with 10% strength. Ready? And hold for 5, 4, 3, 2, 1. Let go, take a breath in. And when she breathes out, we're gonna go flexion, lateral flexion, and rotation a little bit further. Anjali, I'll get you to go three directions the opposite way. Go ahead and hold for 5, 4, 3, 2, 1. Relax, breath in and out. Okay, so what you're seeing me do is essentially we brought Anjali into those three directions. I'm landmarking here. I'm asking her to go in the opposite direction. So she's trying to go into extension, lateral flexion away, and rotation away. I am holding her in this position. All right, so she tries to go in the opposite direction in 5, 4, 3, 2, 1, relaxes, she'll breathe in, and when she breathes out, I'm going to bring her further into those three directions, and my thumb is trying to assist the facet in movement. Okay, so essentially I'm doing a this motion with her each time that she goes. Okay, so again, reassess, find the spot. We are going to bring her away, away, away. She is going to resist. Go ahead, back to neutral. 5, 4, 3, 2, 1. Relax, breath in. And when she breathes out, we're going to go a little bit further while trying to help that facet open. Make sense? Okay. Now, in order to do an extension dysfunction, we have to go towards. All right, so to make it nice and easy, I'm going to pretend the same side is experiencing an extension dysfunction. Okay? We are going to do the assessment first, but I know this is the part that usually confuses people, so I don't want to do too much variance so you can see the difference. Okay, so what you just saw was a flexion dysfunction on this side, the opposite side, right? And I was bringing her this way. For the extension dysfunction on the same side, I have to bring her towards, and towards for that dysfunction. But as I said, we have to sit on the side that she is leaning towards. So to correct an extension dysfunction, I am actually going to be over here. Because I've got to try and do that whole resistance mechanism. Can we actually just trade places so I can show them in the direction that I'm comfortable with? So just the other way. So cute. No, that way. Oh, you need a stool. Short people problems. I'm a short people too. This is for me. Okay. I'm a short people too. Okay. All right. So as we mentioned, the extension dysfunction was on this side here, and we want to go towards. So I've already landmark. I'm going to get her to nice and gently extend. We're going to start flex for us first. Good. And then I'll get you to go ahead and curl into extension. Right there, hold. Good. And then we're going to go ahead laterally flex towards me. There, stop. And then rotation towards me. There. Good. And then hold right here for just a second. Angeli, I'm going to get you to try and flex in the other two directions. Go ahead. 5, 4, 3, 2, 1. Let go. Breath in. And when she lets go, I'm going to bring her further into extension, lateral flexion, and rotation. And my thumb is going to be doing like a J stroke. So again, it's going to look like this, where you're actually trying to bring her into extension with that motion. Okay, so you're going to try and go towards with a J stroke for extension dysfunction, and away with an over, sort of arcing over motion for flexion. Okay, is there anybody who's totally confused about that? Okay, so these ones, just to make it nice and easy, let's just practice with the upper L spine stuff before we start practicing including the pelvic tilt component. Okay, so I would like you to, when I say go, you are going to partner up. You're going to practice your consent for applying this technique. I would like you to go in and actually find a flexion dysfunction and an extension dysfunction and try to perform these techniques to them. And I would like you to go in and reassess. For now, I'm going to go in and reassess that one segment that we targeted in flexion to see if we actually mobilize that a little bit, just for fun. And because good therapists always reassess. Hey, Angela, I'll get you to go ahead and bring yourself into extension for me, please. Good, and then go ahead and curl down for me. Okay, so it helped a little bit, but it still didn't start quite as soon as this other one did. I'm going to go ahead and actually perform that technique one more time just for the sake of trying to get this mobilized. Is that okay with you guys? Yep. Cool. Angela, I'll get you back up to neutral for me, please. So this one is still needing a little bit more movement. All right, so Angela, I'll get you to gently bring yourself down into flexion. Okay, we'll back up and we're going to get you to go slower, please. So go into extension for me. Go into extension, thank you. And then curl down into flexion. Good. Keep going. Right there, thank you. We're going to laterally flex towards me, nice and slow. A little bit more. Perfect, thank you. And then rotate. Good. I'm sorry that my back's towards you. A little bit more. Good, right there. And go ahead, 3 directions in the opposite. Go ahead and hold for 5, 4, 3, 2, 1. Let go, breath in and out. Good. And Angeli, again, 3 directions. Go ahead. 5, 4, 3, 2, 1. Let go, breath in and out. Good. And one more time. Go ahead and 3 directions opposite. 5, 4, 3, 2, 1. Let go, breath in and out. Good. You okay? Mm-hmm. Good. All right, I'm going to reassess that. Okay, we're going to go into extension and then go ahead and curl down for me, please. Ah, that's better. Good. We got mobility happening. Yay. Now, just side fact, you can actually turn this into an actual just mobilization. So what you guys need to know is the MET. If you don't want to have to do the MET in real life, you can just do the mobilization. So I will show you on this side. We'll pretend it's for a flexion dysfunction, so it'll be on the opposite side. Angela, get your arms across your chest. So same motions. We're going to try and get her into flexion, lateral flexion away. I'm on the opposite side now. And rotation away. And all you need to do is when you landmark, Angela, we're just going to get you to just curl in the 3 directions towards me, okay? Mm-hmm. Ready? And you're going to get them to curl, and you're just going to literally go back and forth while your thumb is actively trying to mobilize with every movement, is encouraging mobility to those segments. Does that make sense? Yeah. So you're literally just trying to heave ho as they move to encourage mobility. So I like that one personally, but for the requirements of this course, you do need to know how to do the MET. Okay? Any questions before we get started? Great, let's partner up and let's practice.